Welcome to this educational video about tympanic paraganglioma, a rare type of tumor that affects the middle ear. In this video, we will explore what tympanic paraganglioma is, its causes, symptoms, diagnosis, and treatment options. Understanding this condition is crucial for early detection and effective management. The exact cause of tympanic paragangliomas is often unknown, but research suggests a combination of factors may contribute. Genetic predisposition plays a role, with some individuals having inherited gene mutations that increase their risk. These mutations often involve genes related to mitochondrial function or tumor suppression. Sporadic or non-inherited cases also occur, where the tumor develops without a clear genetic link. Chronic inflammation or other local factors in the middle ear have also been theorized to possibly play a role but haven't been definitely proven. Tympanic paragangliomas arise from specialized cells called paraganglion cells, which are part of the autonomic nervous system. These cells are normally located near blood vessels and nerves. In the middle ear, these cells can sometimes undergo uncontrolled growth, forming a tumor. The tumor typically grows slowly, expanding within the middle ear cavity and potentially eroding surrounding bone structures, including the ossicles, the small bones responsible for hearing, and the temporal bone. As it grows, it can affect the eustachian tube, inner ear, or even extend into the skull base. Tympanic paragangliomas are considered rare tumors, accounting for a very small percentage of all head and neck tumors. Their exact incidence is difficult to determine due to their slow growth and often subtle symptoms. They are more common in adults, particularly between the ages of 40 and 60, and are slightly more prevalent in women than in men. While generally occurring sporadically, a familial predisposition is noted in about 10% of cases. The symptoms of tympanic paraganglioma can vary depending on the size and location of the tumor. One of the most common early signs is pulsatile tinnitus, a rhythmic whooshing or buzzing sound in the ear that often synchronizes with the heartbeat. Hearing loss, either conductive, due to blockage of sound transmission, or sensorineural, due to damage to the inner ear, is another frequent symptom. Other potential symptoms include a feeling of fullness or pressure in the ear pain, dizziness or vertigo, facial nerve paralysis in more advanced cases, and in rare instances, hoarseness or difficulty swallowing if the tumor extends significantly. Diagnosis of tympanic paraganglioma typically involves a comprehensive evaluation by an otolaryngologist or ENT doctor. A thorough medical history and physical examination, including otoscopy, examination of the ear canal and eardrum, are essential. Audiometry or hearing testing helps determine the extent and type of hearing loss. Imaging studies, such as computed tomography, CT scans, and magnetic resonance imaging (MRI), are crucial for visualizing the tumor's size, location, and relationship to surrounding structures. Angiography may be used to study the blood supply to the tumor. Finally, a biopsy is usually not performed for diagnosis due to the risk of bleeding and complications, but may be considered if other diagnoses are suspected. While tympanic paragangliomas aren't strictly classified into distinct types, they are often described based on their size and location within the middle ear. The Fitch classification is sometimes used to categorize these tumors, which helps in determining the best treatment approach. Treatment for tympanic paraganglioma depends on several factors, including the tumor size, location, the patient's overall health, and their preferences. Observation with regular monitoring may be appropriate for small, slow, growing tumors that are not causing significant symptoms. Surgical removal of the tumor is often the primary treatment option, especially for larger tumors or those causing significant symptoms. The goal of surgery is to completely remove the tumor while preserving hearing and facial nerve function. Radiation therapy, including stereotactic radiosurgery, may be used as an alternative or adjunct to surgery, particularly for tumors that are difficult to remove completely or in patients who are not good candidates for surgery. Embolization, a procedure to block blood flow to the tumor, may be performed prior to surgery to reduce bleeding. Unfortunately, there are no proven methods to prevent the development of tympanic paragangliomas. Genetic counseling may be considered for individuals with a family history of paragangliomas. The prognosis for patients with tympanic paraganglioma is generally good, especially with early diagnosis and appropriate treatment. The tumors are typically slow, growing, and rarely metastasize or spread to other parts of the body. However, recurrence can occur, even after successful treatment. Regular follow-up appointments with an otolaryngologist are essential to monitor for any signs of recurrence. Ongoing research is focused on identifying the genetic and molecular mechanisms underlying the development of these tumors, which could lead to more targeted and effective therapies in the future. Recent advances in surgical techniques and radiation therapy are also improving outcomes for patients with tympanic paraganglioma.